Yeah, so the main thing that we see is just food insecurity, and so we know that about 60% of our campus faces food insecurity, which is kind of why we got this thing started up. Yeah, we started it just because we saw that there was a need for a space on campus to help those students who are facing the food insecurity, and so we got set up with diversity, equity, inclusion, global education, and then as well as student government to just kind of help fund this pantry for students and really just to help, like I said, provide a resource that was free to students on campus to help fight food insecurity. We have perishable and non-perishable items in the pantry, and so we've got fresh produce, we've got dairy products, we've got meat and fish, and then as well as baking supplies, a couple different drinks, seasonings, sauces, as well as like rice, pasta, and then some hygiene products as well. So we've got deodorant, shampoo, toilet paper, and just kind of really anything that we hope a student would need, and they can shop once a week to obtain those services. Yeah, so we serve over 600 students a week, and so I think it's continually growing, and so I think that's kind of just surprising for people is that it is very widely used, I would say. The thing that we're most excited about is that our number of kind of regular customers continues to grow, and so we're just excited that we're being utilized and that we're continuing to be able to serve a growing population. And then as our campus continues to grow and change, we know that this space is going to be no longer operable in a couple of years, and so we're in the process of looking for a new space, and so just excited about that chance to find a new space and hopefully continue to have this resource for students in the future.
So my office works with survivors of sexual violence, and so oftentimes I'm receiving students who are experiencing, it could be sexual assault, relationship abuse of any kind, stalking, sexual exploitation, or sexual harassment. One of the things that we're seeing students experience a little more frequently now are any of those issues within digital platforms, unfortunately AI-generated platforms. And so those are some of the things, not necessarily exclusively, but some of the things that we're seeing a little bit more with the way that just technology is used. So the Violence Awareness and Response Program provides confidential advocacy to any student or colleague on campus who's experienced sexual violence of any kind. And I do want to emphasize that that confidential piece means that I am one of very few people on our campus that doesn't have a mandated reporting mechanism. So when students come to me, it's really their choice whether or not they want to report to Title IX and/or law enforcement. Otherwise, what we do is we focus on immediate and long-term safety, what resources are available and what they may want to use, and then we work with them over time to really achieve their goals at their pace. I'm actually very pleased to let our campus community know that since March, we have been working on a crowdfunding campaign here at the university through our advancement office. And this is primarily contributed to by donors and faculty and staff. It is a crowdfunding campaign for emergency resources so that our center is more self-sustaining for students who come to us or colleagues that are experiencing abuse or have experienced harm, and they may need additional support measures offset, so it isn't a financial burden for them. So what we see most with students is it could be anything from they need some support with food, with toiletries, it could be with clothing if they're pregnant or parent. pregnant student or parenting, we have specific grants for them. We have additional resources to help them with those child care-based needs or those medical needs. It can also be emergency contraception. And then we extend into other accommodations where they might need support with changing their parking location. And we know that parking permits are expensive, right? Or they might need help with housing relocation. And then when we think about just some of the longer term support, it can cost up to $3,000, and that's a conservative estimate a year to help one individual financially who's experienced harm. So those are some of the things that we can provide here in the center that lessen the burden on them to seek safety. I really think that the confidential piece of our office is surprising to a lot of our campus community, because when you think about violence awareness and response program, oftentimes I'm asked, are we Title IX? Are we the folks that do the D2L training? And the answer to both of those is no, even though we work very closely with our Equal Opportunity and Title IX team. What gives us the advantage is the confidentiality piece. When someone shares something really private and important about their life with us, we have to keep that completely lock and file unless they sign it over. That's a state law, it's a state mandate. So it really relieves a lot of the pressure of having to report. If the idea of reporting is simply uncomfortable, it puts them at further risk of harm, or they just need some time to think about, like, I need to learn about this process, and is it going to actually be something that feels like it would be helpful to me in terms of an outcome. So I am confidential. My graduate assistant, Saron Tesfaye, is confidential, and then Liz Steinborn-Gorley, who's the director of the Women's Center. So I always tell students, if unfortunately you've been impacted directly or indirectly by sexual violence and you want to talk to somebody about it, we're a good first stop because we don't have that reporting mechanism. I am very excited about, I'd like to inform our campus community, this is a good time to do it, that although we haven't officially completed the contract yet, we are bringing a nationally contracted bystander intervention program to our campus. It is the Green Dot Bystander Intervention Program, and this is evidence informed. It is used by other universities, and then it requires an accountability in the form of assessment. So we are always reporting to them data and outcomes from students who go through those trainings or those overviews on what they're learning in the immediacy, and then we can also create more longitudinal outcomes to see what long-term behavioral changes on a college campus. So this was something that our student government learned about last year, and they provided us with really a more, I want to say, a financial, I want to call it an obligation, but they provided us with budget to be able to bring this in, and I'm really excited to create something for our entire campus community that's a brand around violence prevention and proactive change.
I think the biggest concern facing students at the moment is, especially everything happening politically, is their rights. Not only just women students, but also gender nonconforming folks and male students will come in here with concerns about their rights being taken away and what to do next and where they can really turn to. And really having those realistic conversations of how women belong in the media and the conversations revolving around us, right? I'd also say basic needs are a huge issue going on with SNAP being cut and everything like that. A lot of students have been asking kind of where can they find those resources or go to. Of course, we have an emergency grant and things like that we can offer, but also we shuffle them to other organizations that can better help aid them as well. Women were really fighting for that respect and recognition, especially in higher education. There really wasn't a safe space for women to convene, and they were still marginalized in terms of universities. Often a lot of colleges across the board were male dominated. There really wasn't a safe space or resources for women, right? So our center was kind of created with that in mind and in purpose, to kind of serve those women students and give them the resources, the support, to enlighten them to reach those higher careers. We offer a whole assortment of resources. Like, we'd be here for a long time, so I'll shorten up the list here. But we offer menstrual products for anyone who needs it. We offer safer sex kits, such as lubes, condoms, a plethora of more. We offer academic success coaching through Liz. If any student is going through a tough time or just really needs to talk or get a soundboard for things that they're facing, Liz is always there to help folks out. We also offer confidentiality as well. So if there are any situations that students are facing, we kind of give them those options and plethora of things they can do and kind of go from there. We have a massage chair, we have essential oils, we have a fridge. If you ever need to store like breast milk or anything like that, or even food as you're going in between classes, our fridge is there, microwave, coffee, tea. We kind of have a plethora of everything that students could access or ever need. We even have crafting resources too. So again, we have resources that help aid folks, again, those menstrual products, those condoms, etc. We also have some fun community building stuff like games and crafts. So we have it all at the Women's Center, and we always encourage folks to hang out here, put something on the TV, and enjoy yourself. The biggest thing, like I was touching about earlier, is that men can also access this space as well. Really, like, yeah, it's like changing that stigma that males feel as not wanting to overstep their place in women-dominated places. We kind of invite those questions and learning about our space and stuff like that. So I feel like that's the biggest misconception we deal with, is we serve not only just women, gender non-conforming folks, or male. And again, you don't have to come here every day. You might just be a pit stop for us, or you can come here all the time. You know, use the service however you'd like to. I think changing those narratives on women, like that they're just limited on being a housemaker or doing these common basic roles, when there's so many more opportunities for them. And I'm so hopeful for when that like pay wage gap starts to change, or that gender equity, like when gender equity is seen and recognized by all people, is what I'm really hopeful for, and I believe can change with narratives and more conversation, with more education. I believe changing those narratives is possible.
Well, here at the Counseling Center, we see a number of different students for therapy, and some of the issues, or may I say we call them presenting problems, that these students face fall in line with the following areas, which are anxiety and social anxiety. Social anxiety and anxiety tend to be the higher ones. And apart from that, we also have depression symptoms. We have students who come in with relationship difficulties, students who come in with problems with substance use, and also, given we're on a campus, university campus, academic difficulties as well, such as procrastination or just struggles trying to balance their time and their workload more so. We are the counseling center here in the university. We are of course called the counseling center. Basically what that entails is we provide mental health counseling, so therapy in other words, in addition to some other services. In short, we provide mental health counseling to students, and it's a place where on campus where students can come and talk about what's on their heart and minds. And our hope or our goal is to be the people who can listen and provide any insights as needed, but also help them with getting a sense of direction to where they want to go. So we offer a number of different services. We work on what's called a step care model, and basically that entails going up like a staircase, step by step, on a number of different services. The highest item on that is referring students outside of campus. If we can provide any services, of course, that is usually the last piece we would go to. But before that, we do have a few other options, other services that we have that are options for students. Of course, given we're a counseling center, most students would be like, oh, mental health therapy, oh, individual therapy, one-on-one therapy. That is one of our items or services that are offered. And in addition to that, we also have group therapy, which, like individual therapy, is just as effective. And that is going to be in our group room, which is one floor below the counseling center. And it's just minimum 4, maximum 8 students, all meeting usually for a particular reason, is particular themes of groups, for example. And they go about the whole semester working on whatever comes up within that group. We also offer workshops on anxiety, on stress, and on depression. We offer what I call skill building services or sessions. Some of these skill building sessions work on time management, conversational skills, sleep management, test anxiety. And apart from that, we have other pieces of information and other locations we can send students on campus for other items that come in for that we can actually provide services for. When they find out that we are not actually academic counseling, we provide mental health therapy, therapy in general, mental health services, but given our name is the counseling center, sometimes we would get calls from parents or students or some even other departments who are not as familiar with us or faculty and they would request for more so academic counseling, career counseling. And then we have to clarify to them, sorry, this is not what we do here. We actually are on mental health more so. To see as many students as we can and provide the best services that we can offer, and hopefully have finished up this fall 2025 semester on a good note, but also moving into the spring 2026 semester, helping again as many students as we can, given that we have come up, we're going to be coming up with a few new group options, therapy group options, and some outreach activities as well that we're planning for. So.
We currently have about 850 students registered with our office, and the highest percentage of disability area are students with mental health, psychiatric disabilities. And unfortunately, how that plays out for students in their learning is it is difficult for them to get to class or to meet deadlines. So students with mental health, chronic health, who have more episodic type of health conditions, it really affects their learning in that way. So that's something that we support in trying to help students with just getting back on track with their learning. So there are disability laws, Section 504 of the Rehabilitation Act and the Americans with Disabilities Act from 1990 that drive the work that we do. Because we are a public institution, we are charged with providing equal opportunity for students who do have disabilities, and so that's our primary mission, is supporting students in their classes, in any programs they're in any extracurricular activities, internships, making sure the facilities are accessible. The resources and services would be, it usually entails meeting with the student and explaining what their rights and responsibilities are as a student with a disability, and letting them know about other resources on campus, just because we work pretty closely with student health services, with the counseling center, with student support services, with some of the other tutoring that goes on campus, in collaborating with them and making sure that students are connected in the right way. Within our office, accommodation-wise, we provide accommodated testing, which is probably our biggest accommodation. So oftentimes students have a barrier with demonstrating what they know within the given environment of a classroom, and so they would be allowed to test in a reduced distraction environment, sometimes a private room. Many students have time extensions as well. We look at access to notes and provide that accommodation for students. That could be either a peer note taker, or we have software that students use to support their getting notes. And then we look at books in alternate format for students who have print disabilities. We get books digitally oftentimes, or Braille. Usually it's digital. So students can access the material in a different way. And we have a text reader called Read and Write that students can use to read the print material or the digital material to them. I think a lot of students and/or their family members may not know that we support students with medical emergencies as well. So if they're in the hospital, we would communicate with professors and verify their absence and advocate for them, and sometimes provide advising support in looking at if they've been out for 2 weeks and they are maybe not in a healthy place, or they missed a lot of time prior to that. We would provide some counsel and advising on what their options would be. Sometimes that might be an official withdrawal, looking at incomplete, is an appeal for a tuition refund appropriate. So that's one thing that we do. And then also we provide support to women who are pregnant and are breastfeeding under Title IX. I think I'm hopeful just because we operate as a team here within our office, and students are finding us. So I'm hopeful, and I think that's a promising sign that we're working really closely with other faculty, staff on campus to get students to find us, and they're walking in the door. With the stigma of disability, sometimes that's a little bit hard, but it's becoming a thing where students are seeing that it's their right, and it's an access issue. The other thing I would say I'm really hopeful for is that we have the upper administration backing with digital access and making sure that we're compliant with any online materials and web pages, that we are following the guidelines and are stricter about that. So they have designated staff person. We have a major software that is being used called UJA, and so faculty and staff are getting on board with assuring digital access as well.
Most frequently, I see a lot of students that don't like to get involved in the community, or maybe they are too scared to at first. And I completely understand, because when I was a freshman last year, I had a lot of difficulty kind of branching out and meeting new people because I was so anxious to do so. But I joined a lot of clubs and I forced myself to get involved, and that kind of really helped out. And now, like, I met a whole bunch of awesome people, and I'm leading a bunch of communities. The purpose of Circle K International is to get students involved in volunteering, in the community, and also in leadership roles. So we have 3 tenets in Circle K International, and that is leadership, fellowship, and service. And so these 3 tenets are what we focus on in all of our meetings. So we always make sure like there are opportunities for students to lead, to serve the community, and then also to get to know the people around them. So some resources that we provide to students are a lot of opportunities to volunteer and just get involved in the community. We're really low key, so like with our meetings, you can show up if you want to. I know a lot of other service groups, they have like minimum service hours that you have to do. We don't have that. We like helping out. And so through that, like I said before, we have a lot of services for leadership, as well as fellowship and service to the community. So for leadership, Circle K International, because we are an international group, there's a lot of services that the international part of it offers. So there are global leadership certificates online that Circle K International offers. And then there's also just other ways to get involved in the community. Like through CKI, I was able to branch out and meet all kinds of new people. So something that might surprise people is that we don't have a minimum service hours that you have to hit to be a part of our club. And then to get all the benefits and stuff of being in our club, all the service projects, all you kind of have to do is show up. There's not really any pressure to like have a minimum volunteer hours to be part of our club. And I think that's one reason why a lot of people join, is because like we're really low key. Like we have board game meetings sometimes, we do like blessing bags and stuff, and it's just basically an opportunity to get to talk to people and to just get to hang out. We have a lot of fun opportunities coming up. Our big thing that we do every year is the Kiwanis Holiday Lights. So we go out there, we help out with setting them up. Kiwanis sets up over 1 million lights a year, and this year they ordered a bunch of new lights, so they're going to be setting up over 2 million this year. So that's going to be crazy to see. I'm really excited to see that and to get to volunteer for it for our night in the park that we do, where we just go out, we help out and direct traffic.
In Student Health Services, we see students for their physical well-being as well as their mental health well-being. We're approaching winter, and a lot of times that comes with different mental health issues that kind of come into play. So we work towards making sure that our students know the resources that they have available. We have a massage chair and the relaxation station that students can use, as well as bright light therapy as well, that is for free for students to use. The purpose of Student Health Services is to provide students with a resource on campus that they can go to that is convenient for them to get a variety of services, whether it be mental health services or physical health. So we have regular STI checks, they can go to our lab. We have a pharmacy that they can have prescriptions sent to, or they can receive over-the-counter medications. If they need their annual exam, they can have that done in our clinic as well. Most things that students would see their hometown doctor for, we can see them for in our clinic. We have a mental health therapist who provides counseling. We have nurse practitioners who can prescribe medications for different mental health illnesses. We have a relaxation station available that students will come to. They can take the full body massage chair for as long as 45 minutes. We have the bright light therapy in our relaxation station as well. Students will use the pharmacy by itself if they have medications that they want transferred here for the school year, and then if they go home for the summer, they can transfer it home. I think something that surprises students is that we offer over-the-counter medication for incredibly cheaper price than what you would see off campus. They can have it charged to their student account, and then they have 30 days to pay for that. So if they don't have cash right now, that's okay. A lot of their visit as well as pharmaceuticals can be covered by their insurance. So their out-of-pocket pay, their out-of-pocket cost is considerably less than what you would see without insurance. We are excited to be part of the Future State project. The clinic and the health education office is excited to be part of the transition to that new stadium and new residential hall facility that is expected in the next few years. So Student Health Services will hopefully move over there.